You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people with herniated discs. We're talking about laser technology today. With us, we have an expert on the topic. He's been doing this procedure with great results for more than 16 years. With us, we have interventional pain management physician, Dr. Stephen Watson. Dr. Watson, welcome to the program.
Thank you, sir.
Now, so you're an interventional pain doc.
Right, originally anesthesiologist.
Okay. And so, as we talked on the phone, so you were taking people out of pain while they were asleep, and now you're taking them out of pain while they're awake.
Correct.
Is that fair to say?
That's good answer.
So what is an interventional pain physician? Is there a easy way to explain it?
Interventional pain physicians are commonly today coming from three disciplines, either anesthesia, physical medicine, or neurology. The whole intent of that group then, as they come together, is to try to take the patient that could be a subacute pain to chronic pain and diminish the level of the pain so that they can get on with their life. So they can get back to living, whether it be with their family, whether it be working, and hopefully doing it with a minimum of medication that they have to take or things that they have to go through, hoops they have to go through, if you will, to be able to live a normal life.
So we talked on the phone, and one of the things you said is you want to get them off or try to prevent or avoid addicting medications.
Absolutely.
And big surgeries.
Right.
Is that fair to say?
Absolutely.
And that's what you do as an interventional pain doc?
Yes. That's what my attempt is, and I've been successful many times.
So we're going to talk about this laser therapy for herniated discs. And how long have you been treating it this way? Because you say very few physicians are using this laser.
Yes.
Because it's not covered by insurance.
Right. I got interested in treating chronic pain problems back when I was in residency. And I got out of residency in '92. I started doing interventional pain medicine. I've gone through all the typical procedures, epidural steroid injections, facet neurolysis. I did probably 200 vertebroplasties in my office when you have compressed vertebral bodies. I did put in stimulators, dorsal column epidural stimulators, and all these other things, sympathetic blocks.
All to get rid of pain in the back.
All to get rid of
neck.
Pain and neck and so on, yes.
Okay.
And the problem was a lot of those things would help, but many of them were not long-term results. And I met the doctor who was using the laser, and I became entranced by it. Why? Because I was seeing how it was making a long-term change in people's lives. And so when I learned that, I began to use it, and here I am 16 years later still doing the procedure. And the reason why I do it is because it's so effective in treating patients that in many cases are even told by other physicians, even surgeons, that you're not treatable, and I'm able to relieve their pain. Not necessarily take it all away, but relieve their pain so they can get on with their life.
Get back to work, things like that?
Get back to work, get back to living their life with their family.
Now, look, I've had this show for 25 years. Talked to a lot of medical doctors. Spoke to you on the phone. I was very skeptical. Seemed like you were exaggerating.
Yes.
I went to your website.
Yes.
And you have patient story after patient on YouTube videos.
Yes.
Talking about how they're back to work. It was a miracle for them. They got their life back. I'm paraphrasing slightly.
Right.
But it's just patient after patient saying that it works.
Right.
Right? And a lot of them were accident victims.
Right.
People that were in bad shape.
Correct.
So let's focus in on this herniated disc.
Okay.
What are the patients called? Is it a bulging disc, a herniated disc,
well,
a ruptured disc?
Typically, if you look at an MRI or something, patients will be, they might have heard about bulging disc, but the thing they're going to cue in on, and I would cue in on, is what's called a herniated disc. And a ruptured disc is just the extreme of a herniated disc.
Okay.
There's stages to a herniated disc, and the worst stage is a ruptured, and that's what we also call an extruded disc. That's where the disc
why does it
material
cause
goes out.
pain, though? So if you have a herniated disc, why is it causing pain?
Okay. A disc in a healthy 15, 20-year-old, no blood vessels, no nerves. When that disc is injured, it sends chemicals outside the disc. The body says, aha, there's a problem. It sends blood vessels, grows blood vessels into the back of the disc to bring in inflammatory compounds, try to whip that disc into shape. Unfortunately, that's all right for the most part, but unfortunately, wherever blood vessels go in the body, nerves follows. Now we have these little nerves go in the back of the disc, and those nerves we call nociceptors, which is a combination of the Latin word for pain, noci, nosis, whatever, and receptor, pain nerve. And when the disc is injured enough, there's an annular tear. The annulus of the disc is the outside, the nucleus is the middle. The annulus is like the
Is it
the
pushing
thread.
on a nerve? Is that what's
Not
causing it?
necessarily. Most of the time, not.
Okay.
The issue is that as that annulus tears from the inside out, that nuclear material, which is slightly acidic, touches those nerves, and the nuclear material slightly acidic irritates the nerves. Boom, closes the electrical
So that's where you're
circuit.
getting the pain.
Signal goes to the brain, says there's pain.
Is it like fluid that's coming out of the discs? Gel?
more like a gel. A lot of neurosurgeons will call it like jelly. I call it, for lack of a better term, say the disc is squishable, because you can change the shape. A beanbag chair doesn't have anything wet in it, but you sit down on one corner of it, it's going to change the shape. So that's similar to that disc material, that you can change its shape, or it's a lot like a clay dough or something like that, where you squash it. So you have multiple levels of this annulus around it, and you overpressurize it, and those layers start to tear, and that's when that new material starts to move to the back. When it touches the nerves, boom, you've got pain.
And so you could fix that with a laser?
Yes.
Or help it dramatically?
At least help it.
With a laser.
Yes,
have you ever had a patient say, I'm 100%? Over the years, have you ever had them say that?
Many.
I know you have to be careful with claims of reversing and things like that.
Yes.
But if there truly is a patient that said, I'm back, I don't feel the pain, and that's happened.
My 70-year-old cousin, I've only got 5 cousins. I've operated on 2 of them in their neck. The one cousin is a year older than me, had a herniation in his neck, here 7-1. He had pain from here to here, couldn't open his hand, couldn't use an aerosol can, and 4.5 years later, he works full-time, normal life with his wife, his children, grandchildren. Said, Steve, I have no symptoms. I just spoke to my 79-year-old patient 2 weeks ago that 8 years and 2 months ago, I did a procedure on 4 levels of his neck that were herniated. 2 were extruded. 2 looked like a guillotine blade back in the spinal canal, and it twisted the spinal cord. He had severe neck pain, headaches, pain, tingling, numbness in this arm, and he dropped objects, and he had right leg pain. 4 days after the video testimony on my website, he said, I feel like I'm...
Now, when you got our attention at the Wellness Hour, is when you're telling me on the phone that oftentimes it's not the disc.
Right.
It's the stuff that's kind of leaking out of the disc that's dripping onto the nerves and the blood supply that's created from that. Am I understanding that correctly, kind of?
Not exactly. Again, remember, we don't think in terms of anything dripping, because it's not wet or like that. It's smushable. As it comes out, it's more like a thick gel, something like that.
That's hitting a nerve.
Yeah,
that's hitting a nerve.
Well, it does, but most of the time it's probably not. When you're having pain in your arms, your legs, typically it's probably because that segmental nerve is inflamed, it's irritated. But it's not.
So it's
mostly
being irritated by that gel that's leaking out?
No, remember I told you that when the disc is injured, these blood vessels grow into the back of the disc, and these blood vessels are coming through what we call the epidural space, which is in the back of the canal, and it's just really thin, fibrous, filmy material, and these chemicals are leaking out of the disc and out of the blood vessels like an acid rain.
And that's what's causing the pain?
Yes. The illustration I use with patients is to say, if I'm walking down my sidewalk into my church on Sunday morning with a suit and a tie on, and remember Pigpen from the 70s and 80s, the cartoon character, he's got a cloud of dust around him. If I walk past Pigpen, I'm going to end up with dust on me. Why? I didn't touch Pigpen, but there's this cloud of dust around him. So when the discs become inflamed, they're leaking these inflammatory compounds out, and as the nerve comes out, boom, it gets irritated.
So the next question is, how is it typically treated, a herniated disc, and how are you doing it?
Well, standard surgery 50 years ago was to make this big incision to go in and take out the whole disc, or take out part of it, and then later on take out the whole disc and infuse the patient. And a lot of people obviously don't want to go there.
But that's still being done today. Is that the number one way it's being done today?
Yes, unfortunately.
Why do you say unfortunately?
Well, because there's a lot of data, even with, I'd say, with discectomy and with fusion, that after 5 years, only 20% of the patients that are treated in that manner are any better than they were day one.
Okay.
Well then, but you've gone through this big surgery and everything else like that, and
because there's like disc replacement surgeries.
Yes.
Artificial discs.
Yes.
There's fusion where they remove the disc.
Right.
You're saying.
Right.
So let's start with herniated discs.
Okay.
Because we're talking about laser therapy to help this and to avoid this big surgery. So how are herniated discs typically handled, and how are you doing it?
Well, the old standard, and still being done by many cases, to make a big incision, you go in and the surgeon goes down to the back of the disc, and they will use what we call rongeurs, and they cut off the protruding, if you will, the disc material that's sticking out to make it shrink and take the pressure off the nerves, and then maybe what we call coagulate it to stop any bleeding and wash it out, and they're done.
But that works.
And it works for a while in many cases. The studies clearly show after 5 years that maybe only 20% of those patients are any better 5 years later than they were in the very beginning. So after they've done, if they've not done an open discectomy, they can go to what's been done maybe 20 years now called a microdiscectomy, where you're actually putting a series of tubes in, and you just have tiny little instruments and a camera. You can look through this little tube, and it takes you longer, but you can go in and you're still doing the same thing. You're cutting off the disc.
So it doesn't hit a nerve.
So it doesn't hit a nerve, yes.
Okay.
So the further progress of procedures from just chewing off some disc, surgeons will go ahead and fuse. And there's, I don't know, I believe hundreds of thousands done every year in the United States. And the problem with it is the fusion may initially give good results for the patient. I may feel great for 6 months or a year or 2 years. But what happens is, in many cases, not all the time, but in many cases, after a number of years, it could be 6 to 8 years, 4 years, they begin to develop other problems. So that obviously then becomes, well, was it a good procedure to do the fusion in the first place? I had a 50,
But they do get immediate relief sometimes?
They do. No, a lot of times they'll probably get immediate relief. Why? Because if the 5-1 disc, 5S1 disc in the low back is the problem, and you take that sucker out and you fuse them, they can feel like $1 million until something else happens, until the next.
So let's say a spine is this long, or like
Yes.
this pen.
Right.
If you fuse the middle of it above and below, you say ends up having
one or two
problems.
segments, so within 2 or 3 inches above or below, several segments. That's the problem. So my patient, 51-year-old guy, I don't even know how he came to see me. A number of years ago, he worked in maintenance. He was a supervisor for a property maintenance company, and he had an accident or something like that in about 04, something like that. I think it was 04, 05. He had a fusion of 5-1, and he felt great for several years. Well, then what happens? About 12, he was having severe pain again, so he goes back to that same surgeon, a different one, and now he had a herniation at 4-5. So in about 6 to 8 years, now he starts developing significant pain again in his low back. He has an MRI done, boom, he has a herniated disc of L4-5. Surgeon goes in and he cuts off some of the L4-5 disc, and I'm sure does the rest that the surgeon was doing, and he gets partial relief again for a while, but he quickly has a return of back pain, even more severe pain, and now it's 2 years later. His back pain is so bad, he's continuing to try to work. He's taking 8 to 10 Vicodin tablets a day. So then he came to me, and I did the laser procedure on this gentleman on 2 discs in his low back. So we talked about the procedure. He wanted to move forward. So the procedure is done with the patient on an operating table, and we use fluoroscopy, which is a form of x-ray, so we can actually see what's happening. I'm not making incisions, big incisions. I'm making about a 2 or 3 millimeter incision, just big enough to put a needle through, and you have to do that because otherwise the skin has bacteria, and you could carry those skin cells down and cause an infection. So we make tiny little incision, 2 or 3 millimeter, put a needle in, and that needle I put into the very back of the disc from the skin, and I'm using x-ray to be able to visualize it. Once I have that
So you're
needle,
watching like a movie of the procedure.
well, not a movie, it's just a fixed picture.
Okay,
one
fixed
at a time.
picture.
Right.
And you could see it. Okay.
Right. And so I'm putting my needle in from back like this in the low back, and when it gets into the disc, it has a curve on it already, and I get it to go across the back of the disc. When it's across the back of the disc, back 1/4, all I do is I fire my laser across there several times, and I basically have killed or at least knocked off a lot of the nerves. The patient's overall pain level comes down or goes away at that point.
So you actually are killing some nerve cells.
Yes,
And
absolutely.
So you're
That's
killing
my
the
intent.
cells that are causing the pain.
Yes,
The laser what, heats them up?
yes, absolutely.
You use the laser.
Right.
You kill some of those nerves.
Right.
You take out the laser.
Yes.
And then what happens?
The patient goes home.
How soon do they feel better?
Anywhere from 2 to 3 days, their pain level will be going down. I mean, typically they'll say within 2 or 3 days, 4 days, they're having less pain now after the procedure than they were. And by a week, they're saying, yeah, I'm definitely getting better. And then anywhere from 1 to 3 weeks, people are about 60 to 70% of where they're going to be, and they just keep improving as time goes on.
Why are they improving? Why is it taking so long?
Well, you have to think in terms of, I've fired a laser. That's a lot of high energy in the back of that disc. And I've also caused some minimal damage to muscles by putting needles in. And they're a fairly good size needle, huge, but a needle in through the muscle. And so there's a little bit of muscle damage, and it just everything has to settle down. It's a wound, it's an injury. And the other thing is that the lasers are actually shown, for instance, in dentistry, to actually call regeneration of bone and killing bacteria. This laser is, to a certain extent, probably causing some slight regeneration within the disc itself.
You told me this on the phone. You said, you gave me the teenager story.
Yes.
Tell that story.
So the idea that I tell the patients is, did you ever have a 13-year-old daughter? Yeah. What'd she do at school? Probably a lot of this. What'd she do when she comes home? Picks up the phone, starts talking. Probably the same girl or girls that she's talked to all day long. So it's 3 o'clock, 4 o'clock, 5 o'clock. Everybody's ready to eat. mom is home, dad's home, somebody's cooked supper. If she's got brothers, the brothers are chewing on the edge of the table. They're hungry, but she's going strong on the phone. You can wag your finger, pull the phone out of her hand, unplug it from the wall, go outside, and simply go like this. The moment you do that, she can still talk, but nobody can hear her. That's the primary purpose.
You knock out the cell tower.
Yes.
And she can't get a signal.
Cut the lines.
And
nobody
that's what
can
you're
hear
doing
her.
with the laser.
Yes. Cut the line. Nobody can hear
So
her.
the brain doesn't get the signal
Doesn't
of
get
pain.
the signal, exactly.
Well, logically, it makes sense.
Well, I say, the spine store closed last week. You can't go and get a replacement. Okay. So you've got what you've got. I've got what I have. If I can turn those nerves off and your pain gets better, goes away, that's pretty good.
Now, I don't want to put words in your mouth, but you said this works really well for people that have sciatica.
Yes.
Pain down their leg, their knee, their back.
Yes.
Their in their buttocks.
Yes. Why
does it work so well for that? What's your and are you treating the lower part of the spine, like with the laser?
The issue is that there's not a different mechanism for treating the sciatica versus the low back pain. The foremost attempt on my part is to treat the axial spine pain because it's the disc itself.
That's the cause, you're saying.
That's the cause, and that's what I'm treating. That's number one. All these other things that come along, the leg pain or arm pain, tingling numbness, goes away or gets better by treating that disc, that annulus. And that's one of the big problems with what standard surgical care is that maybe, I've had patients come to me in the past and say, well, the doctor said he could treat my leg pain, but not necessarily so much my low back pain. Why? Because he was just relieving the pressure, the irritation of the nerve for the leg, and so my leg feels better, but my back still hurts. I'm treating the whole disc.
The source? Do you look at it as the source?
Yes, exactly.
Okay.
It's the entire posterior annulus of the disc, and when I treat that, then the leg pain gets better or goes away. Same thing with the arm.
Now, you told me on the phone that oftentimes it's not the disc, and we talked about this earlier, it's that gel that's in the inflammatory response that's irritating nerves and causing pain. Is that correct or no?
Well, again, it's infrequently that the gel, the nuclear material, is really causing a problem. I see patients fairly frequently. They have an extruded disc, and the extrusion itself is actually not the major problem. It's a physical material like the jelly out of the donut, but unless it's really putting pressure up against the nerve, that's probably not it. It is that annulus of the disc which has blood vessels that are bringing inflammatory compounds, and those inflammatory compounds are just like pig pen. They leak out of the blood vessels, and anything that comes by gets irritated, like I use the other term, people say acid rain. That's why you develop the leg pain, arm pain, because those compounds leak out of the blood vessels and hit the nerve. And my best example of that is seeing a patient that has, let's say, herniation on the left-hand side of the neck, but they have right arm pain. Why? That doesn't make sense. Well, I had a neurosurgeon send a patient back to me one time 17, 18 years ago. They said there's nothing to operate on. Why, doctor? Well, because the herniation is on the left and the symptoms of the right arm. When I treat that same patient or one like that, guess what? I treat the whole disc at that level and the right arm pain goes away. So the shape of the disc is not the essential most of the time.
So the laser.
Yes.
Any type of pain that's coming from a disc.
Yes.
And I'm not overstating that.
Nope.
That's what the laser is good for.
Yes.
Now let's talk about
axial spine pain is disc and basically.
So from the neck all the way down to the bottom.
Right.
So that could be hip pain.
Yes.
It could be any pain coming from the disc. So if somebody's watching this and has been told you have a disc problem, you have. And you need surgery for this.
Right.
You're saying at least get a second opinion to hear about this laser. Now, I know the fee of this.
And maybe I see some patients and I send them away. I had 6 months ago, a gentleman comes to me early 60s. I don't know why he ended up coming to see me. And by the time he finished telling me his story, I looked at his MRI and said, no, I'm not going to work on you because, A, you need surgery desperately within the next 48 to 72 hours. Why? Because my procedure could have potentially helped him, but also he could have been worse. Why? He was losing strength in his legs. He was at the point where he was stumbling and falling and needed a 4-point walker. And by the time you get to a motor problem like that, you're falling off the back end of the wagon. And so I was able to get him an appointment within 2 days. And 4 days later, the surgeon had him on the table, did a huge fusion. But 2 or 3 months later, this man calls me, and he's thrilled with what the surgeon did. He's thrilled with the surgeon.
So you will send them out?
I will send them out.
If you decide to move forward with the procedure,
yes,
you believe they're going to get better?
Yes, absolutely.
Okay. So this laser procedure for herniated discs, it's considered experimental.
Yes.
at this point by the insurance companies.
Yes.
As I'm listening to this, and we're short on time, it's like stem cells, right? Europe, NBA, NFL,
Right.
These fighters, they're all using stem cells in the knees and shoulders and necks. And I know doctors, they're giving stem cells from cord blood or the ones from fat, even PRP.
Right.
They're doing it to their family, but they're not doing it to their patients. And they say, because insurance doesn't cover it.
Right.
It would take me an hour with each patient to try to tell them why it's a good idea.
Yes.
Is that the way this laser is? Like what stem, that means, is that what's
It's very,
going
very
on?
similar. It's very, very similar. The stem cells were poo-pooed 25 years ago, but when you start hearing about NFL players that were having shoulders, as you said, then it became more interesting, and now there's thousands of doctors across the country that are using stem cells and PRP. Why? Because it gets good results in many cases, but it's not paid for.
By insurance.
By insurance. My procedure, I've been doing it for 16 years, and it would take 1,000 doctors probably 10 years of doing what I'm doing. It's even used in Europe and around the world because the doctor that started it trained doctors.
Now, this is also interesting about you, that, and we're short on time, so I'm going to talk fast here, but people that are accident victims,
Yes.
they get a large settlement. Those are people that seem to find you.
Yes.
So you do it on those people because, again, it's being paid for by the settlement
Yes, exactly.
instead of insurance.
Right.
So financing.
Right.
Because, like the dental procedures that are like sometimes $60,000 that we talk about on my show, people make payments and finance it. You could finance this as well.
Yes.
Is that right?
Right.
And you offer a guarantee that
Yes.
if after 6 months,
Right.
they're not,
If they're not seeing any relief in 6 months,
you'll do it
then
again?
we'll do the procedure again
Okay.
to try to get them the relief that they.
How robust is it, or how long does it last? Like, what have you heard?
Well, again, the gentleman that's now 79 years old, I spoke to, sat in his living room talking to him 2.5 weeks ago, 8 years and 2 months after I treated 4 different discs with the laser in his neck. And he says, I have no neck pain, no headaches, no pain, tingling, numbness in my arm, no pain, tingling, numbness in my leg. And well, did it really do anything? This guy's 79 years old. He got tired. He lives in a double-wide manufactured home. He got tired of the carpet. He pulled all the carpet up by himself, cleaned the floor, laid
So he did his own
vapor
flooring.
barrier and put in tongue and groove flooring across that whole floor by himself in several days. Did you have any problems with it? He said, yeah, my knees hurt. I said, well, my knees would hurt too if I'm on my knees like that for 3 days. So, I mean, the prototypical pain patient, chronic pain patient, is a person who's had pain maybe for a year or 2 years, and they're doing less and less and less activities, and then they end up having to quit their job. They become morose, they become irritated, they're not making the money they could, so their whole family condition goes down financially. Maybe they lose their home, cars, whatever else like that. They're miserable to be around. If you can treat them, treat their pain gets better. They start to treat their family members better. They can go back to work, they can make money, especially for a male, but even for ladies that are working. When you're working at your chosen profession or job, you feel good about yourself because you're contributing to yourself and your family. Their personal feeling about their self-value goes up, and you treat people better. And so the results of that is that not only is it good for the patient, but it's good for all those around them.
So I had a spine surgeon on the show. He said there's about 400 to 500,000 lumbar spinal fusions performed every year in the U.S.
Yes.
And I'm going to ask you this question. Of those, and look, this is pie in the sky, crystal ball stuff, but how many of those do you think could have been avoided if you could have caught these people early with your laser, in your opinion?
Okay.
This is just a total estimate.
Yeah.
What do you think?
I think 80%.
Really?
Yeah.
You believe that?
Yes.
Good for
Because again, the man, the 79-year-old guy, he had 4 disc herniation at his neck. 2 were extruded. Those things are terrible. He was referred to several surgeons, neurosurgeons. 1 or 2 said, well, I'll work on 1 level. And that was it. 1 or 2 said, well, we'll work on 2. He said, no, I want somebody to take care of my whole neck at once. And he said, you'll never find anybody to do that. So I worked on it. Well, the negativist would say, well, surgeon would say, well, it's not going to last. Well, excuse me, sir, 8 years and 2 months later, he has no symptoms at all. It worked. So that he obviated potentially a multi-level fusion. If he would have had 3 or 4 levels fused, he would be miserable.
So what do you say to the person watching this? They've got neck pain, back pain, maybe sciatica. They've been told by a doctor, you have a herniated disc.
Right.
Okay? They don't want big surgery. They don't want fusion.
Right.
They've heard your speech about this laser.
Yes.
They know it's not covered by insurance, so they're afraid or they're skeptical
Right.
or they feel like it's risky. What do you tell them?
Well, I'm just going to start with by saying that I know it works. I've got 16 years of knowing it works, and numerous patients that have done very, very well that had virtually impossible situations. It has a very low, what we call, I would say, the charges for the equipment to do it, $300 each procedure. If you have done one of the newer procedures for instance, treating a disc, it might be $2,500 for the equipment that's thrown away. Mine's $300. I did 5 days in Turkey in 2011 doing the procedure I do for neurosurgeons around Turkey. And supposedly there's 1,000 doctors offshore neurosurgeons that are doing something with this procedure technique. Why? Because it doesn't cost them much, and they're not worried about being paid.
So is this holistic?
Yes.
Because you're really not adding medications to the area.
No. The laser is taking the
right?
pain away, and if anything, it's probably causing some regeneration in the disc itself. So the disc will never become normal again, but even if it just goes, I say, from where it is extremely injured to being better than that, slightly less injury, hey, that's healing.
Why not just put a pain pump that's delivering this small microdose of pain to that nerve, numbing it, or doing spinal cord stimulation,
yes,
where you can block the signal to the brain?
Right.
Why not do that?
Well, 200 stimulators later that I used to do years ago, and pain pumps I used to do. Pain pumps, the medications you have to keep slowly giving more and more and more, which is a problem.
Okay.
And the stimulators can give great results, maybe for 6 months or a year or 2 years, and then the results are falling off. And so there's every more complicated stimulators being
So you think this is better? I mean, that's the bottom line.
Because it lasts. It's one time you're in and you're out, and it lasts. And people say, how long is it going to last? I don't know.
Now, we're not taking somebody from a 10 to a 0. We're taking somebody from like a 10 maybe to a 4 or 5.
Well, this man was 8 to 10 and he's 0. And there's numerous other patients that have said 0, but a lot of them would come back with that same, I was an 8 or 9 or 10 and now I'm running a 4 or 5. Well, 4 or 5 or 6 years later.
Is this good for somebody that their fusion, they had a fusion.
Yes.
Now 3, 5, 8 years later, pain again. Is this good for those people?
There's a good chance that I would be able to, yes. If they have another herniated disc, which is what typically happens, then yes, I could help them.
Is this a free consultation?
Yes.
If they go to see you?
Yes.
Okay.
Yeah.
And you could be a regular pain doc and take all the insurance.
I did it for 15 years.
In a way, I've had doctors say, Randy, I don't want to have the insurance companies dictate how I practice medicine.
Yes,
do you feel that way too?
Oh, absolutely.
So don't let the insurance companies tell you can't have a new procedure.
Company. Yes, absolutely.
Good for you.
Do what works.
Okay. Well, look, I want to thank you for coming to the show. Good stuff. They go to your website. They should listen. Look, I was beyond skeptical, and I'm still a little bit skeptical. But, when you hear patient after patient after did you pay any of those patients to give you those?
No.
Because they're all over your website.
Yes.
And, well, good for you. I want to thank you for coming on the show. If they want to make an appointment, do they just call your office?
Yes.
Or do they need a referral to see you?
No, just call the office, talk to either Karen or Ashley. And sometimes they'll talk to me if nobody else is around.
Okay, good. All right. Well, I want to thank you for coming on the show. Good stuff.
Thank you.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.